This is the small heart model. Alright, we can see blood vessels coming off the small heart model. Over here, these are the left and right brachiocephalic veins. They fuse to form the superior vena cava. Way down here is the stump, represents the inferior vena cava. This wrinkled stuff here, that is the right auricle for the right atrium. Open this up. Here's the right atrium. These little lines here represent the pectinate muscles found only in the atria. Open this part up. Here is the right ventricle. Here is the tricuspid valve. These little strings are the chordae tendineae. They attach to these red bits, which are the papillary muscles. The other red wrinkles on the inside of the ventricle is the trabeculae carni. This is the pulmonary valve going to the pulmonary trunk. Here is pulmonary artery. Here is another pulmonary artery going to the lungs. Blood returns oxygenated. Back in focus, please. With the pulmonary veins entering into the left atrium. This wrinkly structure is the left auricle, again, of the left atrium. Here's the bicuspid valve. The strings are the chordae tendineae. The red bits are the papillary muscles. We're now in the left ventricle, so left atrium, left ventricle. The ridges on the sides are the trabeculae carni. This entire piece of tissue, if I just cut it out, that would be the interventricular septum. Way up in here, see if we can see it. Way up in there, you see that is the aortic valve, way back there. That sends blood to the arch of the aorta, or aortic arch. This is the brachiocephalic trunk, the left common carotid artery, the left subclavian artery. You have to remember, left common carotid artery, left subclavian artery. Alright, and then, doopy-doopy-doo, we have the blood vessels on the surface of the heart. So coming out of the aorta, we have the right coronary artery. And right over here is the left coronary artery. So off the aorta, right coronary artery, left coronary artery. Right coronary artery splits into the marginal branch right here. And then it wraps all the way around and becomes the posterior interventricular branch. So posterior interventricular branch. Put this back up. The left coronary artery splits into the circumflex branch and the anterior interventricular branch. This is the anterior interventricular branch, circumflex branch. Then blood goes to the heart's muscle mass. The heart sends the blood back out through veins. This in front is the great cardiac vein. Great cardiac vein wraps all the way around and is still great cardiac vein all the way around. We have this little vein here. Get in focus. This is the anterior cardiac vein. It empties directly into the right atrium. Over here is the small cardiac vein wrapping around the right side. And flip this over. This here is the middle cardiac vein. And then the great cardiac vein, small cardiac vein, middle cardiac vein, they all empty into this structure, which is the coronary sinus, which then empties into the right atrium. And that is it for this model.